Well, hey there, and welcome to our channel. My name is Sarah, and I'm here today with iHealthBrokers to talk all about Medicare Savings Programs. So even though Medicare is actually much less expensive than most other health insurance options, if you're living on a fixed income, it can still be a financial hardship. Luckily, there are programs that are designed to help pay for monthly premiums, copays, and coinsurance. So stay tuned because today we're going to talk all about Medicare Savings Programs. Many people don't know that they need to pay for Medicare at all, and actually that's partially true. Most people don't have to pay monthly premiums for Medicare Part A, which is your hospital insurance. However, there is a monthly premium associated with Medicare Part B, which is your outpatient insurance. And when you add those monthly premiums to copays and coinsurance and any of your other financial needs, if you're living on a fixed income, it may become a financial hardship. So like I said, there are some programs that are designed to help limit your expenses. These are called Medicare Savings Programs. Today we're going to be talking about those in this video. And this video actually comes at a special request of one of our viewers. So if there are any videos that you'd like to see, let us know in the comments. So like I said, today we're going to be talking about Medicare Savings Programs. There are four basic types. There's the Qualified Medicare Beneficiary Program, which is the QMB, the Specified Low-Income Medicare Beneficiary Program, which is the SLMB, the Qualified Individual Program, which is the QI, and the Qualified Disabled and Working Individuals Program, which is the QDWI. I know that's a lot of letters to remember. Okay, so the QMB program and the SLMB program are actually the most similar, just slightly different financial criteria. Then there's that QI program. That's the most similar to the SLMB program, but it can be a little bit more restrictive due to its application process. And finally, the QDWI program is entirely different. We're going to break down each of these individually throughout this video. Now, there are criteria, both financial and otherwise, that you have to meet to be eligible for these programs. However, even if your income doesn't exactly meet the requirements, you may actually still be eligible. So if you have any questions, you can reach us here at iHealthBrokers at 888-410-0344, or just leave a question in the comments below and we will absolutely do our best to help. We're licensed health insurance brokers. We're licensed nationwide with over 200 carriers, and there is no charge for our services. Medicare Savings Programs are Medicaid administered programs. So they're jointly funded by the federal government and Medicaid. Now, if you want to learn all about Medicaid in general, we have a video that's all about Medicaid in general, and I'll put that in the description below. So the programs work a little bit differently and the benefits do vary, but generally speaking, they're designed to help cover the copays, coinsurance, and monthly premiums of Original Medicare. Now, Original Medicare is broken down into two different parts. There's Part A, which is your hospital insurance, and Part B, which is your outpatient insurance. For most people, there is no monthly premium for Medicare Part A, but there is a monthly premium for Medicare Part B. And some of these programs can actually help you pay for that monthly premium for Medicare Part B. Now, first, in order to enroll in a Medicare Savings Program, or in order to be eligible, you first need to enroll in Medicare. And a lot of people are automatically enrolled in Medicare. And there's one of two ways really to go about it. You're either going to become eligible through age and employment or through disability. So you have to be a U.S. citizen or permanent legal resident. If you're enrolling through age, then you need to be over 65 and be eligible or receiving Social Security benefits or railroad retirement benefits. You may also be eligible through disability. Now, like I said, there are different programs and the benefits do vary from program to program. So it's important that you figure out exactly which program you're eligible for. Now, if you want to learn more about Original Medicare in general, just check out our video that's all about Original Medicare, and I'll put that in the description below as well. First, let's discuss the Qualified Medicare Beneficiary Program. So for this program, there are limits imposed upon your resources and income. Your resources are basically liquid assets, things like cash that you have in a checkings or a savings account, and stocks or bonds. However, they do allow you to set $1,500 aside for funeral expenses, so bear that in mind when we're going over the numbers. Now we're going to break down exactly what those limits are for your resources and income. However, I do want to remind you that they tend to go up on a yearly basis, so even though these are the current numbers, make sure to check out Medicare.gov to make sure that you're staying up to date. Currently, the individual resource limit is $7,860, and the married couple resource limit is $11,800. So again, those are your liquid assets. Money in a checking or savings account, stocks, bonds, however, you can take out that $1,500 for funeral expenses. Your individual monthly income limit is $1,084, and your married couple monthly income limit is $1,457. However, limits are slightly higher in Alaska or Hawaii, and I just want to mention, for all the different programs, they're slightly higher in Alaska and Hawaii. Now, if you're still working and your monthly income actually exceeds these limits, you're still going to want to go ahead and apply anyway because you may still be eligible for benefits. Also, like I said before, these income limits do tend to increase on a yearly basis, so go ahead and apply anyway. Now, if you are eligible for this program, you'll receive assistance paying for your monthly premiums for Medicare Part A if you have to pay a monthly premium. You'll also receive assistance paying for your Medicare Part B monthly premium. And Medicare providers, doctors that accept Medicare, cannot charge you for covered services. That includes your deductibles, copays, coinsurance, none of it. The only exception to this is outpatient prescription drugs, but you will automatically be enrolled in the Extra Help program that helps to pay for Medicare Part D, so pharmacists can only charge you up to $3.90 for a generic prescription drug that's covered by Medicare. Remember, these are the current numbers, so you're always going to need to check Medicare.gov to make sure that you have the right information. So the Specified Low-Income Medicare Beneficiary Program is very similar to the QMB program. It has those limits on your resources and monthly income that you have to meet. So currently, the individual monthly income limit is $1,296, and the married couple monthly income limit is $1,744. The individual resource limit currently is $7,860, and the married couple resource limit is $11,800. Now, you've noticed that those limits are a little less stringent than the QMB program, and because of this, the SLMB program really only helps to pay for your Medicare Part B monthly premiums. However, that really is still a huge help. Additionally, you'll also be automatically enrolled in that Extra Help program, which helps pay for Medicare Part D. The Qualified Individual Program, or QI program, is a little bit different. So the financial criteria are less stringent than the two other programs that we've discussed so far, but the application process can be a little bit trickier because you do have to enroll every year. Also, the applications are granted based on a first-come, first-served basis, and priority is given to those who are re-enrolling. So it's important that you remember to re-enroll. Also, QI benefits will not be granted in conjunction with Medicaid benefits. All right, let's break down those income limits and resource limits. So currently, the individual monthly income limit is $1,456, and the married couple monthly income limit is $1,960 or higher in Alaska and Hawaii. And the individual resource limit is $7,860, and the married couple resource limit is $11,800. Like the SLMB program, the QI program will help to pay for your Medicare Part B monthly premiums, and you'll be automatically enrolled in Extra Help for Medicare Part D. Finally, there's the Qualified Disabled and Working Individuals program. Now, this one is totally different from the other three programs, and it applies to a very specific section of people. Because this one is only going to help you pay for Medicare Part A, which for most people is free. However, you're going to want to look into this program if you're under 65 and you were receiving Medicare through a disability, but now that perhaps you've gone back to work, you're no longer receiving free Medicare Part A and the state isn't helping you. Now, do remember though, if you're continuing to work, once you hit those 40 quarters, you're no longer going to be charged for Medicare Part A. However, this program can help to bridge the gap and help to take some of the financial burden off until you've met those 40 quarters. Now, like the other programs, there are financial criteria that you have to meet to be eligible. Currently, the individual monthly income limit is $4,339, and the married couple monthly income limit is $5,833, or higher in Alaska and Hawaii. The individual resource limit is $4,000, and the married couple resource limit is $6,000. Now, like I said, this program is only designed to help you pay for your Medicare Part A monthly premiums if you need assistance. You're not going to automatically be enrolled in that extra help program. However, you can still choose to enroll on your own. And for that, you're going to need Form SSA-1020B, and I'm going to put that in the description below as well. One more thing that I want to talk about are DSNPs and how those come into play with these Medicare Savings Programs. Now remember, Medicare Savings Programs are administered by Medicaid, and many who are eligible for these Medicare Savings Programs can actually take advantage of DSNPs, which are dual special needs plans. These are basically a Medicare Advantage plan that encapsulates the benefits of Medicare Part A, Medicare Part B, Medicare Part D, and a lot of other benefits as well, and they combine these with the benefits of Medicaid. Now, these don't work with all the types of Medicare savings plans, so make sure you talk to your broker about exactly what your needs are. We also have a video that's all about DSNPs if you want to learn more about those, and I will put that in the description below as well. If you're unsure whether you qualify, make sure to call your local Medicaid office. And as always, you can check out Medicaid.gov, that's Medicaid.gov for further details. Of course, you can always contact us here at iHealthBrokers at 888-410-0344. We will be happy to answer any and all of your questions, and we can help you with these Medicare Savings Programs or DSNPs, as I mentioned earlier, or any other type of Medicare program that you might be interested in. We really are the Medicare experts, and like I said before, there is no charge for our services. Now, for some of these programs, as a reminder, they are first come, first served, like that QI program, so don't let the grass grow under your feet. Look into it today. If you like this video, please make sure to click like and subscribe as well to stay up to date. And of course, if you have any questions, please feel free to leave them in the comments below, and we will absolutely do our best to help. Or even if there are any other videos you'd like to see, let us know. Thank you so much. Have a great day. Bye-bye.